Good evening. On behalf of the college, Raja Peary College and the health unit of the college, we welcome Dr. Tanvir Reza in this webinar series on Corona. The webinar series was conceived by our principal, Dr. Sudip Kumar Chakraborty, who could not join this event today due to some technical reasons on his home. His broadband actually failed. So it was conceived by our principal for students and the local community towards awareness of Corona, so that they can be better prepared towards perhaps prevention of the disease, towards management of the disease if at all infected due to certain coincidences that may be various. Now, in this webinar series today, Dr. Tanvir Reza would share his views and practical experience towards prevention of this disease. Dr. Reza specializes in COPD, bronchitis, asthma, tuberculosis, sleep apnea. He has completed his MRCP degree and has also held various senior house officers towards preparing in the post-graduation examination. He has done various asthma or lung awareness programs in schools like Don Bosco, La Martiniere, in institutions like the Raj Bhavan, the Grand Hotel, to name a few. Today, he would be giving his deliberation at Raja Peary College webinar series on Corona. Dr. Tanvir Reza, I request you to start your deliberation, please.
Thank you, Shantanu. Shantanu has already introduced me to you. Essentially, for the last 4 months, I've been seeing patients with Corona. Having seen them, touched them, examined them in close quarters, I hope I haven't had it yet. But mentally, it feels as if I've had it half a dozen times and I've recovered, and I've had it again, and I've recovered. And if this can happen to me, this can happen to anyone or everyone. That is the mental or psychological bit. Physically, I haven't had any symptoms which would corroborate with the physical aspects of Corona. But unfortunately, Corona affects us not just physically, but mentally also. And during this pandemic, everybody getting depressed, everybody feeling low, everybody cooped up at home. I had started a series of Facebook posts called Humour in the Time of Corona, just to cheer people up a bit, to mentally lighten them up. And the posts have been quite appreciated. And Shantanu, I think, picked up from there, and he's named the whole thing as Humour in the Type of Corona. Unfortunately, in today's 1 hour program, not much of humor is involved. So do pardon me for that. It's a serious topic. My job today is to make sure that whoever is attending this webinar knows how to protect themselves and how to look after themselves and their immediate relatives and friends so that they remain safe. The next 5 or 10 minutes, I'm going to show you how over the last 4 months I have kept myself safe in the outpatients, despite the fact that on any particular day, I might be seeing about 8 or 10 patients of Corona diagnosed or suspected. They are sitting right next to me in my chamber. With my stethoscope, I'm examining them. With the pulse oximeter, I'm checking their saturation and pulse rate, sitting next to them, talking to them. So my exposure has been much, much, much higher than, let's say, an average person who is a non-medico in the community. So all I can tell you is that if I am safe, you can be safe too. And the next, as I said, 5-10 minutes, I'm just going to demonstrate what I normally do. And I'm going to spend quite some time discussing masks, because masks are one thing which have kept us safe. In the early stages, there was a lot of emphasis on sanitization, hand washing, etc., etc. Those remain. But over time, over the last 5 months, the shift has been from sanitization to masks because data has evolved, information has been updated, and we know a bit more about how it's transmitted. So I'm not even for a second suggesting that stop washing your hands. It's just that the emphasis should be more on proper usage of masks. Now, whenever I discuss masks, the first thing I ask people is, if the general public is wearing masks, is it for their own safety or is it for the safety of others? And I discuss this even with friends and colleagues. Even doctor colleagues give me the answer that, oh, I'm wearing it to save myself. And I'm talking about the ordinary cloth masks or the triple layer cloth masks. I'm not talking about the N95s or the surgical masks. So this is an ordinary cloth mask. There is nothing here. It's just the most comfortable mask I wear. And the reason for showing this is you just put it across on your face, and the place where I wear this mask, I'll show you 2 or 3 different types of masks, and I'll tell you where I use what, so that it gives you some sort of an idea as to what to wear where. So this cloth mask I wear when I sit in the car with my driver. I don't know whether he's an asymptomatic carrier or not. When I go shopping, or when I go for a walk, or when I'm basically outside the house, in the lift, down the stairs, in the corridors. Even when I'm entering my chamber, I'm still wearing this because there's hardly any time which takes me to get from the car to my chamber. So this is the ordinary cloth mask. The advantage of this is it's cheap, it is washable, and it's very comfortable. The important thing about mask is if it's not comfortable, people don't wear it. So that is the advantage. But where can you wear this? You can wear this where the chance of you acquiring the virus is lower or low. And where is that? Apart from the high risk places like hospitals or nursing homes, you can wear it outside. Now, coming back to the question of why do we ask public to wear masks, especially cloth masks? The reason is not to protect themselves. This doesn't protect me because the size of the virus is smaller than the minimum size of the cloth here. Then why are we wearing it? We are wearing it so that if I have it, and if I am talking or breathing or sneezing, if I talk into this or breathe into it or cough into it or sneeze into it, the big droplets which would contain the viruses, they don't come out. So essentially, if I'm coughing into this, they get stuck here inside. Minimum comes out. So if minimum comes out, the chances of somebody else getting it from me is minimized. There's nothing called zero, but the idea is to protect others. And we know that if the majority of the population, 60–70%, if they wear the mask, that acts as a barrier to transmission. So I repeat, when I'm wearing a cloth mask, this is very important for everybody to understand. When I'm wearing a cloth mask, I am not protecting myself. I am protecting myself to an extent, but I am not absolutely secure in a very high risk environment. In a lower risk environment, I get some protection, but I give a lot of protection to everybody around me. It's very important to understand. I'll be quite happy to take questions because this turns the whole theory of the mask upside down as far as the general public is concerned. Quite a few of you would already know about this, but when I wear a mask, I protect not only myself to an extent with the cloth mask, but to a great extent, I protect people around you. Next is the triple layer surgical mask, which surgeons used to wear once upon a time. They even wear it now. The reason it's called triple layer is because inside this, if you pull it apart, there are 3 different layers. This is the outside layer, which is water resistance, if you can see. So if you drop water on it, it just goes away. So if somebody sneezes or coughs on you, that acts as a barrier. The inside is water absorbent. So it absorbs the moisture which we breathe out, talk or cough. The reason I keep mentioning talking, breathing, coughing, sneezing is that's essentially how the virus comes out. So while I'm talking to you, I'm opening my mouth, and if there are viruses in the throat or the nose, I am breathing it out, and that comes out in the environment. And what this does is it absorbs the water vapor or the droplets on which the viruses travel. So this again is comfortable, and it acts as a cushion. It absorbs it, keeps me nice and comfortable. Between the two is a treated layer, which I can't show you unless, of course, I cut it, which has microfiber, and it's supposed to be treated. And that essentially absorbs or traps the viruses. So that is why this is a triple layer mask. You can easily see the first layer. I can see through that. And this one, I've been able to manage to separate it. I can see it. I don't know whether you can see it or not. And there's another layer in between. The thing with this mask, again, is that it should be applied properly. Any mask, the basics of mask philosophy is it should cover the whole of the nose and the mouth. Yeah, because we see lots of people with the mask here. It's a no-no. Mask here, it's a no-no, because then it doesn't subserve any function. The last is the N95 mask, which comes in, is basically shaped like this. The specialty of this mask is over and above your triple layer mask. There are a couple of more layers in here. But the very basic difference between the two is, whereas this does not form a tight shield around your face, this does. So when I wear this, way to where it is here, and then all around. So whereas that mask had leaks here and here, this sits tightly. Okay. Now, because I know I'm in a very high risk environment, I'm not taking the risk of just using one of these. This goes on top of that. And I repeat, this is not for the common public, but it is for people who are entering high risk areas. So thus this gives me an additional protection, additional barrier. And if there's any leak in the inner one, I cover that up with the outer one, so that I am completely sealed. And whatever I'm breathing in through the 5 layers of the N95 and the 3 layers of the triple mask. Now, there was also some talk of the virus entering the body via the eyes. Fortunately, I wear glasses, but you have gaps around the glasses, and in order to cover that, I use a face shield. So what does the face shield do? The face shield protects you if accidentally the mask of my patient comes down and it accidentally coughs or he sneezes, it falls on this. That would be first area of protection, and majority would fall on it. And because it's not, the viruses can't penetrate it, it acts as a complete or total barrier. For the eyes, the glasses would be the second layer of protection. For the mouth and nose, which are the major areas of concern, would be the triple layer surgical mask and the N95. So without a PPE, and I repeat, without a PPE, using these 2 masks and the face shield, I have managed to keep myself safe. And so can you if you are in a very high risk environment. I repeat, most of us are not in that very high risk environment. Most of us are wearing the mask to protect others, and if everybody thought accordingly, then the majority of the population would remain safe. Now, how do we contract the virus, or how is it transmitted from one to the other. The basics are very same. While I talk, very simple. While I talk, when I sneeze, when I cough, it comes out in water droplets. They don't go very far. Most of them are big droplets which fall next to you. Some of the smaller ones travel through the air and go a bit further down and then fall down. In order to explain, I give an exaggerated example of if I sneeze here in Kolkata, I cannot give somebody in Delhi the disease. It doesn't travel that far. There are controversies regarding aerosol or droplet infections. We will not go into that. I am here to simplify things rather than complicate things. I need to be protected. You need to be protected. What is the most important thing which needs to be protected? My breathing. How am I breathing? Through my nose. How am I talking? Through my mouth. If I breathe just through my nose, I need to protect that bit. Occasionally, I might breathe through my mouth. If my nose is blocked, I need to protect both my mouth and my nose. So one, we mentioned transmission. Second, most importantly, we mentioned how to keep ourselves safe, how to protect ourselves. Third will come the question of sanitization and hand washing. Now, I have for the last 10 minutes been harping, 15 minutes been harping on the mode of transmission and protecting ourselves. I have discussed this within our community of chest specialists and critical care specialists. And my personal opinion is, if you ask me what degree can I or a person, what are the chances of a person getting it from the doorknob? My field, this is entirely my opinion, would be possibly less than 1% of my patients get it from there. 99% would get it via aerosol or droplet infection. So why am I unduly perturbed about hand sanitization? Not actually. I do it to an extent that I keep washing my hands with a sanitizing solution between patients. I wipe my stethoscope and I wipe the pulse oximeter. But I have seen patients in my chamber who refuse to sit down on the chair to be occupied with the patient because the previous person was sitting on it. Now, there is no logical reason for that. Just because somebody sat on that, and even if they did have the virus on their clothes, it does not mean that it will automatically get transmitted to your clothes and then you go home or somehow the other you get it. It's very highly unlikely. I repeat that I'm touching those patients, examining their neck, their face, their chest, and yet I am safe. There's no reason why you have to think that just by sitting on the chair left by the previous patient, you're going to get it. But that is the fear. Science speaks differently. The other thing is the question is of gloves. For the same reason, I never use gloves. Gloves can be very counterproductive. If we assume that it's spread via fomites or via objects or via our hands, then there are two reasons or three reasons why I don't like gloves. One, I can't sanitize my gloves properly because there will be crevices within it because it's never ever absolutely skin tight. So if there are any viruses and if you feel that those viruses can be transmitted to others, they will be hidden there. And the next time you touch something else or your own face, theoretically, you can get it. That's the first point. Second point is there's a general feeling that just because I wear gloves, therefore I am safe. And just because I am safe, I do not have to take other precautions. That gives you a false sense of security. Once, I don't believe that the gloves are giving you any security at all. In fact, I find them counterproductive. Second, and they are not necessary. Second, even if you're wearing it, you feel that, okay, I'm quite safe, so let me do whatever I feel like. And the third thing is that with gloves, if it's torn or something, if there are any virus particles, they'll go onto your hands. And if you're not careful while taking the gloves off, donning and doffing gloves or PPE equipment is very, very, very crucial. It's the same thing with your masks. For example, if my patient has been sitting right across me and if he's actually coughed on me, this is an infected area. So if I touch this, and then if I rub my mouth or my face or my nose or whatever, the chances of me getting it from there is quite high. So touching the insides, possibly safe. Touching the outside, especially if that is the only thing you've been wearing in the absence of the shield or a further surgical mask, becomes a bit of a dangerous thing. So when doctors and nurses and paramedical staff put on PPEs or masks, it's a tedious process. And when you're taking it off, you have to be equally careful that you don't infect yourself or others. The other problem with PPE and masks nowadays is getting rid of them. You can't just throw it away anywhere, because if they are contaminated, you will be contaminating others. So much as far as masks are concerned, and as far as PPE is concerned. Between sanitizing solutions and hand washing is far superior. We know that, but for example, not in all clinics or chambers do I have a sink and a running water line. So something being better than nothing. Use the sanitizer. If you don't have water, if you do have water, then wash your hands. One more thing, as far as clothes, hair, feet is concerned, personally, the chances of getting it from my hair, giving it to someone else is quite low. Similarly, from my clothes, as I mentioned, or my shoes. So I do not wear shoe covers or even head covers. I go home, I head straight to the toilet, take my shirt off, take my trousers off, dump them, take a shower, wash myself, and I am clean. However, remember, this is something I keep repeating. General public with low exposure does not necessarily or do not necessarily have to do this every time they leave the house and every time they come back. So if you're going out for some small chores or something, doesn't mean that if you go out 10 times you've got to take a shower every time. Be sensible, be logical. Assess how much of a chance there is for you to get infected. If it's quite high, if you're in a very crowded market where you've gone shopping for vegetables and fishes or whatever, you approach it one way. If you've gone to, let's say, Parad Dukan and you've just come back and you've hardly interacted with a couple of people, you don't have to have similar take similar preventive measures. So that's as far as prevention is concerned. As far as treatment is concerned, lots of controversies, lots of doctors will give us lots of opinions as far as management is concerned. I will tell you what I follow as far as the mild to moderate patients who I manage at home is concerned. I'm not talking about the very severe patients who are being admitted to ITU or who's requiring high oxygen or requiring ventilators. And the reason I'm sticking with the first group is because this first group, any of us could be suffering from it, and therefore it's applicable for us. If it's severe enough and if you're in hospital, it's no use discussing it. So what do? I give them a multivitamin. I give them calcium and vitamin D, and I give them vitamin C. Now, do any of these kill the viruses by themselves? The answer obviously is no. Do I use anything else? The answer is no, unless of course there is an indication for it. What are my views on things like HCQ, which ICMR has instructed, I think, more than a couple of months ago? I haven't taken it prophylactically myself. I'm not convinced that it works. There can be lots of arguments to and fro for using it or not using it. I know lots of doctors who are using it, but personally, I'm not convinced it works. If a data comes where I'm convinced that yes, it does work, I shall definitely use it on myself and I shall use it on my patients. But right now, I'm not convinced of the efficacy vis-a-vis the safety factors. Other things like ivermectin and favipiravir and remdesivir, etc., I shake my head primarily because there's no convincing data. All I can suggest is wait for more information to come out. In mild to moderate cases, all you require is supportive care. A few patients require oxygen at home. What they do require is monitoring at home, which is essentially what I do. So I have a service where I have a COVID home monitoring and management service. 9 o'clock in the morning, 8 o'clock in the evening, all my patients who are monitoring from home send me their oxygen saturation and pulse rate along with the temperature. During midday, I make a video call. I see how they are, how talk to them, allay any fears, allay any anxiety. If they have any further problems, I ask them. Everything is sorted out by either telemedicine or by WhatsApp. So if suddenly somebody develops a loose motion or a diarrhea or a tummy pain or any other symptoms, that is sorted out immediately. This usually carries on for about 10 days. After that, I normally discharge them. We're doing this successfully. And the reason for doing it is very simple. In a time when the numbers are increasing, in a time when people are panicking, the last thing we require is hospitals being inundated with patients who don't require admission. We know celebrities have been rushing to hospitals to get admitted, where they are in the hospital for 2 weeks, 3 weeks, even without oxygen. If you require monitoring, you don't require a hospital. That is why the government is, or even the private hospitals, institutions are coming up with halfway houses, where hotels are being transformed to sort of daycare services, where somebody can keep an eye on these people, provided they can't stay at home. The problem is that if you don't have enough rooms for isolation, suppose there are 5 of you, and if there are just 2 rooms, you cannot isolate one person in one room and then dump 4 others in one room. So these are the people who would require these halfway houses or hotels. If you have enough rooms, you can stay at home and recover. During recovery, what should the diet be? Or even if you're not infected, what should the diet be? Have your normal diet. You don't require anything special. Dal, bhat, or curry, maj bhaja is essentially what we have at home. Continue having that at home. If you can throw in some vitamin C, food, fruits, that's fine. There is a fear that talk khele thanda lage or something or the other. It's again a bizarre concept which I personally never got my head around too. Why it started, where it started, but ever since I was a kid, I've been hearing it. In fact, it's counterproductive. Vitamin C is good for your immunity. Now we are giving it to you in the form of tablets. You don't actually require it. Lebu jol, rosh, jole, nun diye, chini diye is good enough. Take oranges, take any fruits you want, whatever is available. I don't, during these times, you have this tendency of constantly sitting at home, doing nothing, watching television, listening to music or whatever. You have to get up, you have to walk, you have to exercise. If you do yoga, do that. Even in a small room, you can exercise. Room is not necessarily a constraint. It's all in our heads. We have to get our heads sorted out rather than there's one. We can make thousands of excuses not to do something. Just one reason for doing it. That's because we want to do it. We can remain well mentally and physically even in this pandemic. It's up to us to remain well. After some time, even people like us, it does become, day in and day out, all I'm doing is seeing these patients and just wondering when I'm going to get affected. That fear will remain. That fear is not going to go away, and we can't conquer that fear by just sitting at home and hiding. Not all of us can afford to do that, and even if we can financially afford to do that, mentally we can't. So today, if not tomorrow, we need to go out. We need a breath of fresh air. We need that sunshine. We need the greens which we require to see. We need to walk. We need to exercise. We need to do everything. Lots of questions regarding if my neighbors got it, can I have it? No, the viruses can't penetrate the walls of your flat and give it to you. So what do I do if I'm living in a building where another family is suffering from corona? From your point of view, as long as they do not leave their flat, you should be okay. Now, they will require support. They will require a lot of support as far as getting essentials is concerned, as far as getting medicines are concerned. What about sanitization? My problem with fogging and sanitization is we know that the virus in the normal atmosphere at our temperatures lasts for 3 to 4 hours. On particular surfaces like steel, etc., it can last for 2 or 3 days, but most of the times on wood, on cloth, hardly survives for 4 to 6 hours. And how do we know when these people were infected? We don't know that. So, yes, if you want to clean the place up, that's fine. That's not an issue. But do we have to ban them completely from our lives? No, that would be criminal. What if you get it the next time? Lots of times, my patients have said, the doc, first couple of months I was completely indoors, and then I started going out to the office or to the clinic or wherever. And then first couple of months there were no maids coming to the house, no cooks, no drivers. Anytime you're interacting with any of these people, you have to be careful. So when you are going and meeting someone, you have to be careful. If you're allowing somebody to come to your place, you have to be careful. What I'm going to do is I'm going to stop here now, and I'll see if I can answer questions, because it becomes very one-sided. I'm quite happy to try to answer questions that might make it a bit more interesting. Shantanu? Dr. Rana had sent me quite a few questions.
Thank you, Dr. Reza.
Yes.
In the chat box, I still haven't received any new questions.
Okay, I have a few questions here which was sent to me earlier. I'll just try to answer them till we get any questions in the chat room.
Okay.
Is that okay?
Okay.
So first question was, how many days till we have to wait for the vaccine for COVID-19? That's anybody's guess. Whether the vaccine is going to work or not, the quality of the vaccine, whether it's safe or not, I have no idea. No one does. Now, vaccine has become a political question rather than just a medical question, and we can't just sit around waiting for the vaccine. What I would suggest is we take precautions, like I have just suggested, and then we keep ourselves safe. If and when a vaccine comes, that will be a good thing. But in the meantime, don't sit for a vaccine, don't wait for a vaccine. Try to get into normal life and living as much as you can, taking all the precautions we've mentioned. So I hope that answers any questions as far as vaccine is concerned. Next question was, 70% alcohol-based sanitizer really work for coronaviruses? The answer is yes, but there is a way of applying it. So just applying it in your hand like this and doing this is not good enough. You have to take a sufficient amount and you have to apply it throughout. The most important areas are your fingertips, which invariably gets missed. And if those get missed, and then if you apply it on your nose and your mouth, then the chances of you getting it is quite high. So yes, apply it for at least some time, wave it in the air so that it dries off. Only then would it become safe for you to touch the next patient or move on. High protein is very useful to prevent corona, but is it also dangerous for the patient who have high pressure? Then what is the solution for these patients? You don't require a very high protein diet which people use to lose weight. Just average. I'm not asking you to do anything out of the ordinary. What I'm asking you to do is just be sensible. If you have dal bhat, maj bhaja and torkari at home, have that. If you have the occasional egg every other day, have it. If you have milk every day, every other day, have it. If you have paneer or cheese every other day, have it. Alada kore kichu korte hobe na. That is all I'm saying. Just do whatever you were doing. You should be okay. But early on, if your diet was very high in carbohydrates or fats, See if you can bring that down and just increase the protein component. Don't go over the top. And the next question was, is it much more airborne rather than contact spread? I think I have explained to this in details that the airborne, it's airborne, and airborne till proven otherwise, because it's a respiratory virus in the respiratory tract. Until any further studies or information comes, you have to take it as an airborne spread rather than a contact spread. Contact spread, if it does happen, would be the exception rather than the rule, and even CDC and WHO have mentioned it in their latest guidelines. Next question was how to get rid of the panic and anxiety about COVID-19. Panic and anxiety you can get rid of by information and knowledge, as is true with any other panic situation. If you know how you are going to get it, and if you know how to prevent it, you'll be far more relaxed. But remember that if doctors have got it in the hospital, and this is again known scientific fact, it's not that they have got it while they were fully PPE'd in the ICU or CCU or ITU or OT. Our friends in the UK have said that while they are in the ITU or ICU or OT, they're all very, very, very careful. Nobody does anything. Everybody is taking precautions. That's happened for 4 to 5 to 6 to 7 hours. And then the moment they step out, they're very relieved. And this is from the early days. This is from evidence from, let's say, March or April or even May. And this is from the UK. These are friends telling us over WhatsApp and phone calls. And then everybody's relieved, duty is over, and then they sit down and chat in the doctor's room or the medical room where everybody sits and has food. And there the masks come off. And there, if there is somebody who's undiagnosed, untreated, he gives it to everybody else. So that is the danger. You can't let your guard down no matter where. The only safe place you can be is at home. The moment you step out, depending on the degree of danger, one, you wear masks and you take precautions. So this is a very good example of where we tend to let our guards down. So during ward round, during operation, everybody is all geared up. What happens? Then you step out, even within the hospital, you're talking to your colleagues, swapping notes. Oh, what's going on? That sort of a thing. Masks come down, guards come down, and we are spreading it amongst ourselves. It's not happening everywhere, but that would be a very good explanation as to how it does spread around amongst doctors and nurses and paramedical staff. When I say doctors, I just don't mean doctors. I mean everybody working within the hospital. You need relaxation. You need to divert your mind. Yoga is very good. Upset freehand exercises. Go for walks. I drag my 76-year-old mother who has diabetes for the last 30 years, who's got blood pressure for the last 30 years. I drag her down from my flat, down the lift every day, force her to take a walk. And when she comes back, she says, I'm feeling better. And the day we miss our walk, when it's been raining, brishti poche, jete parchina, she says, ajke jete parini, that sort of a thing. And if she can do it, there's no reason why the rest of us who are younger and fitter can't do it. So how do we get rid of panic and anxiety? Also use meditation. I listen to a lot of music. During these times, I know financial difficulty theke jaye. Kintu despite the financial difficulties, we have to balance. On one side is tension, anxiety, fear. On the other is financial problems. I understand if you can afford it, buy a couple of subscriptions to music or movies or whatever. Anything to make you feel happy. Talk to friends. Get a hobby. Photography is my hobby. Unfortunately, I've not been able to focus on photography for the last 4 months. So I've sort of sidetracked on to music. So these are the things which we can easily do to keep our mental stability, crack jokes, read jokes, spread jokes, whatever. Next question is, can this pandemic actually going to cease? That's anyone's guess. I would hope and pray yes, it does. Another question would be how long? That's again anybody's guess. Ke jane, আমরা তো at least predict করছি না that এই বছরে শেষ হবে এটা. It will definitely spill over to the next year. Next year, for how many months? This is all conjecture. I don't have any data as a scientist to fall back upon to tell you that exactly next amar janmodine next year 25th February shop thik hoye jabe. I can't say that, unfortunately. Next question was, there are quite a few questions here. What preventive measures should we take if somebody tests positive in the neighborhood or in the family? Right, family now what I'm facing on a regular basis is person or two people testing positive, but whole families. So one family had 11 patients who were positive. Right now, a couple of families I'm looking after have 4 and 5 people positive at the same time. So essentially what happens is, 2 মাস ধরে সবাই বন্দি ছিল, everybody was safe. একজন বেরিয়েছে either কাজে অথবা বাজারে অথবা বাড়িতে মেড কুক অথবা ড্রাইভার এসেছে who had it. One person gets it, and after that everybody gets it, because we are living in a closed environment. এখানে বলে দিই that the environment you are in will matter quite a lot. So if you're in a closed space, যদি বন্ধ জায়গায় থাকি আমরা, তাহলে চান্সটা অনেকটা বেড়ে যায় of getting the virus, primarily because the virus has nowhere to go. This is a closed room. It will keep circulating till I breathe it in. On the other hand, যদি আমি বাইরে থাকি, যেহেতু হাওয়া আসছে, বই নিয়ে চলে যাবে. So it just goes away. So another question is, do we require to wear masks while walking outside? আমাদের একটা gated community আছে যেখানে বাইরের লোকজন আসতে পারে না, so I can easily walk outside without a mask, and there's a lot of good breeze, blowing right across. So যদি আমার থাকেও চলে যাবে, কিন্তু there's a kintu. I wear a mask primarily to make it a point to show people that if as a doctor I can wear a mask outside, so can you. Because not everybody understands where to wear a mask, when to wear a mask, and how to wear a mask. So the message is, once outside the house, always wear a mask. So what happens if somebody is tested positive in the house? One, he or she has to be isolated completely, tokhuni, and then treated, monitored. Second is what happens to the people in the rest of the family. Rest of the family ideally should be tested for COVID. And the reason is twofold. One, they have to go through the process, the healing process, which normally takes 7 to 10 days to 2 weeks. And two, in future, if we as scientists make up our mind and say that no, we can't get it the second time, we are not sure yet whether we can get it again and again or not. But if we as doctors feel that no, we'll never get it again, then at least we know for sure that we've had it once, and therefore the chances of getting it again is low. Arekta proshno chilo is arekta situation chilo where people have symptoms.
Dr. Reza,
হ্যাঁ বলুন।
এখানে আমি একটু ইন্টারাপ্ট করছি, আমাদের ইউটিউবের থেকে কিছু প্রশ্ন এসেছে, আমি একটু জিজ্ঞেস করতে পারি? এখানে প্রশ্ন আছে দুটো, ইজ এয়ার কন্ডিশন অর এয়ার কুলার সেফ ফর আস?
ওকে, এয়ার কন্ডিশনারের ব্যাপারটা ইটস টুফোল্ড. এয়ার কন্ডিশনার থ্রি থিংস. ওয়ান ইজ ডিক্রিজ দ্য টেম্পারেচার, decrease the humidity, and filters the air. Okay, now decreasing temperature, decreasing humidity is not going to cause us harm, and filtering the air is good for us. So patientরা যখন আমায় জিজ্ঞেস করে that আমার already হয়ে গেছে, can I use the AC? Yes. যদি আমি একা বাড়িতে আছি and আমার বাড়ির লোকের জন্য কেউ ইনফেক্টেড হয়নি, yes, it's very safe. There is no অন্যভাবে এসি আপনাকে ভাইরাসটা দিতে পারবে না। এখন এসির দুটো মোড আছে, একটা হচ্ছে ক্লোজ মোড যেখানে এয়ারটা ভিতরেই সার্কুলেট হচ্ছে, আর একটা হচ্ছে ওপেন মোড যেখানে বাইরে থেকে হাওয়াটা টানছে, ভিতরে সার্কুলেট হচ্ছে, আবার বাইরে পাঠাচ্ছে। Between the two closed mode, if there is anybody else in the house who might be infected, is not that safe. Open mode টা যেহেতু বাইরে থেকে হাওয়াটা টানছি, and this is what happens in most of the offices. Centralized যেখানে AC থাকে, সেখানে the room air is recirculated by pulling air from outside anywhere between 6 to 8 to 10 to 12 times an hour, depending on the setup of the AC. So AC by itself is not bad, but you have to understand if there is somebody else in the room, and if it's a closed room, then the chances of you getting it is much higher. So it's a closed space which is dangerous, but not AC per se.
Okay. Sir, আরেকটা প্রশ্ন আছে. Is it harmful to use too much sanitizer?
There have been some reports of skin eruptions, etc. So yes, as I've explained to you throughout the talk, that more than the sanitizer, we should be focusing on masks. And with time to come, possibly, we might even say that, okay, you don't possibly require to use the sanitizer so much. So yes, just be sensible. I'm not asking you to constantly dip your hands in a sanitizer all the time. As a normal layman, when would you use the sanitizer? When you're going out of the house, possibly when you're coming back from home, from outside, entering your house, possibly. This thing about when you're entering a mall, you're using a sanitizer. When you're entering a shop, you're using a sanitizer. And for that matter, this temperature checking is also become a farce. As we know that even for 50 to 60 to 70% of the patients might not even develop fever. So as information and knowledge evolves, our activities will have to evolve. Then yes, you can't have too much of sanitizer, and just be sensible.
Okay, so there's another question regarding masks. It says, considering the ill effects of biodegradable surgical masks made of polypropylene, would you suggest the general public to wear 3-layered cloth masks?
I think we've discussed this earlier on during my talk. There is a place for cloth mask, there is a place for surgical mask, and there's a place for N95. Our repeat kochi N95 usually in hospitals, high risk areas where you know that you will be exposed to people, and quite a few people. So that is essentially what I showed. I use this along with the surgical triple layer mask on top of that for maximum protection, and a face shield on top of that. Okay, the cloth mask, I repeat, is more to protect others than to protect ourselves. The cloth mask, what it does is, if I have it, it stops the spread of the virus from me to others. So if everybody, or 60 to 70 to 80% of the population wears just the cloth mask, we will be able to stop the spread of the virus. The problem is that not everybody wears it properly. Any other questions?
There's another one. If someone visits home, what should be the precautions for the home members?
As in what? What's the question? Visits home manita ki? What does it mean?
The question says this much only. I think that person is asking whether if somebody comes to your home for a social visit, I think he means that only.
Okay, fine. This is a very good question. Let me be practical and tell you that you can't keep your friends and family away forever. So suppose somebody is coming to your house, what do you do? One, sit in an open place, if possible. So baramdae rather than ghore. Two, jodi ghore, keep all the doors and windows open. Three, doors and windows open, all fans on. 4, jodi pedestal fan hoy, that's perfect because it will blow the wind in one direction only, and you can sit and chat, keeping your physical distance with or without your mask. Jodi khola jayega thake, that's a perfect thing to do. If not, keep your doors and windows open. Try. What you should not do is close the doors and windows, put on just the AC without the fan on. That is dangerous, and without mask. Remember, the chances of you getting it from someone else will depend on whether you're in an open or closed space, one. 2, how close or far you're from the person, and 3, how long you have been interacting with the person in a closed space without mask. I hope that is clear.
Okay, sir. Then there's a question. How long will a COVID survivor remain immune to the disease?
We don't know that. That is the $1,000,000 question. How long are we immune from the disease? Whether we can get it again or not? There have been studies earlier from China in March where people have supposedly got it again after being tested negative. They have been positive. From the general community public point of view, I think you'll just have to wait till we know a bit more. We do not have the answer to that question.
Okay. Sir, why is the disease so regularly causing respiratory disorder? And there's another related question. How is diarrhea connected with the disease?
It is a respiratory, as I said, it's a respiratory virus. So you're inhaling it, it's going through your nose, mouth into your lungs, it's causing problems there. Let me discuss a couple of other practical issues here, which we face on a day-to-day basis. Suppose somebody says that I have fever and I've had fever for 3 or 4 days. Doc, I want to come and see you. I said, fine. What I normally tell them is, before you come and see me, get a CT scan of your chest done. And I'll in a sec tell you why. And then I ask my technicians downstairs to give them the CT plates, and then they come and show me in the chamber. So when I'm seeing them, I already have the CT plates in hand. And there I can visually see whether the lungs are affected or not in the CT scan. Why am I doing that? I am doing that because the CT is a very good sensitive test to pick up COVID infection in the lungs. And the sensitivity is so high, it's about 98% or 99%. The chances of picking up is so high. Whereas the RT-PCR, which is the gold standard for COVID-19, the sensitivity is about 70%. So if I have 100 patients with COVID who I test with a nasopharyngeal swab, with RT-PCR, out of 100 known COVID patients, 70 will be picked up, 30 will be missed. Okay? Now, these 30, I know for sure I will pick up with the CT scan, provided it's done at the right time. So both of them together, there's a very good chance that I'll pick up whether the patient has COVID or not. Now, what happens if the CT is positive, but the COVID RT-PCR is negative? If the CT is positive, I know I'm going to repeat it again. If both the CT and the COVID is negative, then I know in all probability the patient does not have it. The other problem is that the RT-PCR takes about 2 to 3 days for me to get the report. And I might not be able to wait for so long. The CT scan tells me straight away that yes, the patient has viral pneumonia. It doesn't give me the COVID answer, but it does tell me that the patient is suffering from a viral pneumonia, and it also tells me the extent of the disease. And if it's quite severe, I can make out straight away. And if it's mild, I can make out straight away. So yes, that is essentially how the patient is getting, is inhaling, affecting the lungs. From the lungs, it spreads to the rest of the body. We do know that it causes gastrointestinal symptoms. More than 50% of my patients have loose stool. It's not actually watery diarrhea, but it's semi-formed or semi-liquid stool. And the virus has been picked up from the feces at the same time. Now, we don't know whether there's a fecal-oral mode of transmission or not, so that remains to be proven. And if it does happen, then to what degree or extent that happens, we don't know. So yes, there are gastrointestinal symptoms. Kids get tummy pain, for example. Adults get loose motion. That has to be treated symptomatically. And obviously, we all know that it affects the lungs.
So as you said that it can be an oral route, it's not proven yet. So there was a question, how do you process our food?
We don't process our food. This is, and again, I've known people who bought Shobji Torkari from the bazaar, put it in the sink and put some sanitizer soap solution. That's all rubbish. From my point of view, okay, you are not going to buy vegetables and ultimately cut them, chop them, and not wash them and cook. Correct? So you are going to wash those vegetables whenever. So you do not have to sanitize vegetables for goodness sake. I know people who've actually put soap solutions and wash them. You don't require to do that. Minimum or maximum you can do, put it in the sink, run some water over it, take it out, let it dry and store it away. That's all you require to do. And finally, when you go around to cooking it, remember you're cooking it in heat. You're not having raw vegetables. Same thing is applicable to fish, meat, or anything else. So when you're cooking, the viruses are going to die either way. And remember, I've said that most of the viruses, if any, survive for 4 to 6 to 7 to 8 hours. So when you're storing the vegetables, if there are any viruses, they would die either. And remember, we still don't know if there's a minimum infective dose of the viruses, as in the number of viral particles we require to get infected. So even if I touch one virus, and if I touch my nose, for example, it doesn't mean I'm going to get a florid COVID-19 response, which is going to send me up to the hospital.
Okay. Sir, I have a question. I just want to ask, you talked about the mask a lot. What about the disposal of those used masks? Can we reuse them? Can we wash them and reuse?
Sure. Most of these N95 masks can be worn for a particular number of hours. The manufacturers don't actually tell you how many. When I sit in my clinic, I'm using it for a maximum of 2 hours. And I can make out when it's too dirty or soggy or whatever. So what I tend to do is I tend to keep 2 or 3 or 4 of these, and I tend to divide it in days. So if I've used one mask on Monday, I keep it aside, and then I take another one on Tuesday, I keep it aside. I use another one on Wednesday, I keep it aside. I use the one I used on Monday again on Thursday. So I keep rotating it. So one mask lasts me for quite a number of days. That's point one. Point two, if I am going to use a mask like this, which is a specialized N95 mask for more than 12-14 hours, then I've just got to throw it away. Now, what do I do with my cloth mask? Cloth mask, you can wash it like you normally wash your clothes. Now, what are the chances of you getting the disease by some particles outside? It's minimal. You can just wash it, hand wash it in the washing machine, whatever. It hardly matters what you do with that.
Okay. Sir, I also face a personal problem that I want to ask. I use specs. And when I go out with masks, they get soggy. This moisture, a lot of moisture, and I can't see. And also with the ears, if you don't have too big a ear, then it's with your with your specs and the mask is quite difficult. So what do you suggest?
See, I face it personally. So what I tend to do, I'll just show you. So when you're wearing the mask, you wear it, and then lift your glasses, tuck your mask over your nose, and put your glasses over the mask. So now, if you can see, my glasses are over the mask. What people tend to do is the other way. One, it's not safe, and two, it gets fogged. But despite doing this, it doesn't always prevent fogging. And when I wear the face shield, the fogging becomes worse. I've seen some YouTube videos where they suggest that if you use soap and water before wearing your glasses and then wipe it, and then that prevents fogging. You can try that. But it remains a practical problem.
So there's been a question has come up. Is there any chance or incidence for COVID infection from a crowded road or place without touching or droplets someone who has proper protection?
The chances are minimal. You have to remember what the proper protection is. The proper protection is a proper mask worn properly. So if you're walking down a street where there is so to say viruses around, if you're wearing your mask properly, the chances of you getting it is minimal. The chances, I repeat, of getting a virus would be if you're in a closed space for a prolonged duration of time without mask with somebody with the disease. since the street is an open space, the chances of you getting it is very, very, very low. It's never ever zero, but it's very low.
So, what is your take on bazaar? Because মানে বাঙালি আর বাজার এটা নিয়ে প্রচুর parody হয়েছে, অনেক বলা হচ্ছে. In fact, this recent lockdown is for that only. So, what do you suggest about it?
Bazaar remains a problem. ঠিক আছে, bazaar remains a problem, but it will not be a problem. আমি একই কথা একঘেয়ে আমি বলে যাব কারণটা হচ্ছে that you can't run away from it. ঠিক আছে, and কি বলবো, যদি majority of the people wear masks বাজারে properly, including যে জিনিসপত্র বিক্রি করছে, যে কিনতে যাচ্ছে, that's point 1. 2, যদি আমি কারোর সঙ্গে অনেকক্ষণ যদি সময় যদি spend যদি না করি আর খুব যদি কাছে যদি না যায়, the chances of me getting it from the bazaar is low. Problem is সবাই এই তিনটে জিনিস মানে না. Invariably মাস্কটা গলায় ঝুলছে অথবা না. আমার পেশেন্টরা চেম্বারে বসে এখানে ঝুলিয়ে রাখছে, বকুনি দিতে হয় to pull it up. আর বাবা নাকের উপর লাগা, না হলে কোনো লাভ নেই মাস্ক পরে, বিকজ এরা তো বুঝতে পারছে না দ্যাট ওরা যে মাস্ক পরছে আমাদের জন্য, এই যে বেসিক একটা জিনিস বোঝাতে পারছি না. সবাই ভাবে দ্যাট ওরা নিজের জন্য মাস্ক পরছে, when it's not necessarily correct. এই যে cloth mask, you're wearing it for everyone else. If everybody wears it, then you are safe. সেটা আর বোঝাতে পারি না. And it's only in the very high risk areas do you wear something like an N95 mask. এতটুকু বোঝাতে পারি না. And talking about mask, the ones with the valves, তাই জন্য banned, because যখন আমি নিঃশ্বাস নিচ্ছি ফিল্টারটা হচ্ছে, valveটা বন্ধ থাকছে, কিন্তু যখন আমি ছাড়ছি ভেতর থেকে, it opens up and the air spurts out. And সেখানে যদি আমার যদি হয়ে থাকে, it comes out in a gush. And there that spreads it. So আবার চেম্বারে বসে যতগুলো valve mask পরে পেশেন্টরা ঢোকে ওদের বকুনি দিতে হয়, তার বাবা এটা চেঞ্জ কর.
Okay. Sir, there is a question. Recently, a very pathetic incident at Kolkata in R.N. Tagore Hospital. A young doctor passed away without any comorbidity. Several comorbid patients also recovered from COVID. What is the reason, do you think? I mean, people with comorbidity recover, but some, like in this case, without any comorbidity, that person died.
The only we can just guess why some people some people respond to such a severe extent, whereas the others. I have a relative who is 82. একদিন জ্বর হলো, দ্বিতীয় দিন he was fine. পরে জানতে পারছি that somebody else was affected. তারপর retrace করে জানতে পারলাম that yes, he also had it. And পরে he was tested positive, this 82-year-old. And we've had people above 90 who've absolutely be fine. One of our guesses is possibly to do with the viral load or the initial যখন infection টা হচ্ছে. If you got agada virus particles coming in, that's just this is just theoretical rather than a known thing. This is conjecture, as I keep saying. That is one. That the viral load initially was quite high. Second is that when the body responds to the viruses, exactly like an allergic reaction, there's a hyperimmune reaction, and that happens differently with different people. So hote pare, even in the absence of comorbid conditions, one of these two or a combination of two or some other factor which we don't know yet could have contributed to the guy's demise or to the severity of his disease. You just have to wait till more information comes out.
Okay. Sir, there's a question like education, it has stopped. The exams has been postponed. Or so what is your take? Because the government now is thinking that from the next month, probably they are thinking of reopening the schools and colleges. But this is also the time it is picking up the infection. So what is your take on it?
This is a question I had to answer nearly 2 months ago. One of my patients, I look after the kids, 2 kids. And the mom wanted to know whether it's safe to send the kids to school. Like in any medical therapy, like in any medicine we use, we always have to balance the pros versus the cons, the efficacy or the benefit vis-a-vis the side effects or the issues which the patient might face associated with the disease, with the treatment. Now, we cannot shut our children off permanently from schools. That's a fact. Just like we can't hide ourselves away permanently in our homes and hope that we will be healthy. That's not done. It's not normal. Even 2 months ago, I had said that these kids, most of them recover very quickly. The maximum mortality we've seen is in people above the age of 60, 65. Then the second category is between 45 to 60. It does not mean that kids do not die, but the chances of anything catastrophic happening in kids is very low. And the other thing is they will spread it amongst each other. That's a known thing. Now, whether that is necessarily bad, I'm not sure. The only problem is when they go home, if they are carrying it with them, what are the chances of the other family members getting it? There's no right or wrong answer. But what we have to balance it is mental issues of children vis-a-vis physical health of children related to COVID. There's no right or wrong answer. It is a very, very, very difficult situation which we have never faced before in mankind's existence, you can call it. And there's no right or wrong answer, as I repeat. If schools open, I presume it will be up to the individual parents to decide whether they're happy to send their kids or not. And you'll just have to wait to see what happens.
Sir, what would you say about the young adults? Our students in colleges, they're from 18 to 22. That is their age range. What do you tell about them?
I would say go out, join college, do whatever you feel like, but be careful what you do. Take all precautions.
Okay. Sir,
take all precautions, but back to normal. This is not going to go away.
Okay. So there's a question which has come up. I'll just repeat 3 questions which are on the similar line, I think. There are many people who are taking vitamin C tablets every day for immunity. Is there any need for it? Then there's a question, which medicine is better to increase immunity? I think this person is asking for immune boosters. And there's regarding food something, how should we store the salad? How should we store the salad? Salad, S-A-L-A-D. Raw
I think I've answered most of these questions earlier on. Most of our patients are getting vitamin C, the benefit of which we don't know for sure. Just because I take vitamin C does not mean, 1, that I'll be cured of COVID, or 2, I shall not get COVID. Both of them would be false information. Salads you store, if you got a fridge, you just store it in a closed box in a fridge. I don't know what, you don't have to do anything special. As far as food is concerned, aage bolechi that Bangali dal bhat torkari mach bhaji is good enough. Have nutritious food, have green vegetables, have vitamin C in your diet.
Okay.
We've discussed all this.
Is COVID-19 related to any blood group of human? There has been a report regarding this.
I'm not sure. I'm not sure. It might or might not. We see there are lots and lots of these reports, case presentations, whatever's. The bottom line would be, you should know how you can be safe. And that remains irrespective of your blood group. Just because I'm group O and it's being noted that group O does not get it, that doesn't mean I'm going to go out into a crowded place without a mask. And that is the essential answer to that question.
Okay. So there's a question. What is the socio-economic status of this pandemic situation?
Make this the last question, if you don't mind, huh? Dr. Mondo.
Yes, sir.
Can we make this the last question?
Okay. So, what is the socio-economic status of this pandemic situation? Since you are treating patients, that is a question that has been asked.
What is the socioeconomics? As a doctor treating patients, I don't see how that's relevant to me.
Now, the patients that you treat, do they belong to any particular economic status?
No. They come from all strata of society. One of my patients was an industrialist who's sitting on hundreds of crores. It's irrespective. It started off as a rich man's disease. So people who lived abroad came here, and then it spread to the rest of the people, including all the strata of society, to the extent that you have people in villages who've got it now. So it's not restricted. It's not restricted to any one particular strata of society. No.
Okay. Sir, since this is the last question, then thank you, sir, very much that you have, out of your busy schedule, you have been with us for this more than an hour. I would request Dr. Shantanu Rana to please deliver the formal vote of thanks.
I, Dr. Shantanu Rana, coordinator, Internal Quality Assurance Cell, on behalf of the college, would like, and the entire team and all the attendees, would like to extend a very hearty vote of thanks to Dr. Reza. Thank you, Doctor, for your opinions and practical experiences regarding Corona. Most importantly, perhaps, the statement that you made about you cannot keep your friends and relatives forever away. It's true, it's very true, and I hope all our students and staff in this pandemic situation keep themselves safe, also not being away from the society. Lastly, I would like to thank the Microsoft Team support group for their relentless support in production of all the webinars till date. Thank you.
Thank you, Shantanu. Thank you for having me.